Good afternoon, everyone. This is Dr. Priscilla and Dr. Kim with MD plus D.V.M. We want to thank you so much and thank all of our subscribers for joining us today. We have a very special show, and Dr. Kim is going to let you know what we will be talking about.
Thank you, Dr. Priscilla. So today we're going to be talking about something that is a more serious topic, but it's a topic that all of us will be faced with at some point in our life. We're going to be talking about coping with loss, coping with the death of a loved one. And the reason why we're talking about it today is because we are in the middle of this pandemic. And I know in our hospital, we don't allow a lot of visitors in. And a lot of the patients at the height of the pandemic were dying alone. And it's a kind of a somber topic, but it's a topic that I think we as clinicians don't get a chance to really address beforehand. So the patients are already in the dying process or already very gravely ill, and then we have to bring it up to their loved ones. So talking about it now before things get to that point, which, you know, all of us have an end date, is something that we don't want to think about, but it's the reality. And talking about that now is something that can give people comfort and bring people peace. And so today we're going to have special guests that will talk about it from an animal standpoint, talk about it from animal support and animal assistance, as well as from the physician human side in palliative care and hospice and what that looks like. And just understanding the benefits of both of those types of services and how that can really, really make that process a much more peaceful and much more beautiful process when you look at it from that aspect. So that's what we're doing today. And I hope you guys really enjoy it because I think it's really important.
Yeah, I totally agree with you, Dr. Kim. It's not a fun topic to talk about, but it's the reality. And like you said, we see it all over the news. And in the United States, especially the COVID numbers are going back up. I mean, people are fatigued. You know, they're tired of sitting at home, and it's understandable. We are social creatures by nature in terms of like how we like to get out and spend time with our friends and family. We like to even get out with our pets and go to the pet park or take the pet to the pet store or talk about our cats. And a lot of times we take that community online, whether it's on our social media platform or we send pictures by email of our pets. So this is a really important topic when we think about anxiety, loneliness, and death when it comes to humans and pets. So this is a really unique topic. Again, we are MD plus D.V.M, and we usually what we try to do is bring together human physicians and veterinarians to have one health discussions and talk about things that you just wouldn't normally think about in terms of human and animal care. So with that said, I'll do some quick housekeeping. Remember today that while Dr. Kim and Dr. Priscilla, myself, she is a human neurologist, I am an animal doctor, a veterinarian, that these opinions are our own and they are not of those of anyone else, any employers or any friends, any family or anyone. So these are our opinions and ours alone. Dr. Kim, you want to go ahead and introduce our guest today? Are we ready?
Sure, let's do that. So for the physician side, I would like to introduce Dr. Delani Mann Johnson. Dr. Delani is a friend of mine that I've known for, 19 years. I met her in St. Louis when she moved there to fulfill her National Health Service Corps agreement. She is a board certified internal medicine physician. She went to Case Western University for medical school and went to the University of Michigan for residency. And she practiced internal medicine for about 10 years and then had a change in the way that she wanted to practice. So she went back and got board certified in palliative care and hospice care. So she's a palliative care physician with an organization in North Carolina. And she is one of my dear friends, and I'm so grateful that she's agreed to come on and talk to us today.
That's wonderful. And before we bring Dr. Dell on, I just want to let the viewers know that they can find her on LinkedIn, and I am going to, as your comments person, I'm going to put that information on our comment board so you are able to find Dr. Delani Mann-Johnson, because I know she has some wonderful things to share with us today. With that said, we also have another doctor on today on the animal side. Her name is Dr. Rhesa Houston. She is a graduate of Tuskegee University School of College of Veterinary Medicine, the same college that I graduated from. And she is a practicing small animal veterinarian, but she also owns her own business called Assistance Animals Consulting. And just, I'm going to read to you really quick about Dr. Rhesa. She has been fueled by a desire to bridge the gap between healthcare professionals and patients prescribed assistance animals. Dr. Houston, in doing that, has founded Assistant Animals Consulting. A first of this kind, this business is in short a virtual consulting firm of licensed veterinarians, both of which are human animal bond certified. And we're going to talk more about the human animal bond today as well, Dr. Kim. But she partners with healthcare professionals and animal owners and business owners to provide education and facilitate healthy, safe environments for assistance animals and their owners in order to make the animal-human bond successful. So we are just really excited about our guests. They are phenomenal people. They do some phenomenal things, and it's just it's a blessing to be able to bring them together to talk about this very important and somewhat sad but important topic. So we're going to go ahead and bring them on in, and they are coming on. Hello. We're excited to have them. Dr. Rhesa, I think your video has turned some.
How did that happen? There you are. I mean, I'm like, what
there you go. It happens. Technology.
That's what happens on live when we're live. That's why
I love it. It's live TV. So we just make it work.
I thought it was gonna be me. It was me.
Okay. Well, we're going to go ahead and get started. Dr. Kim, you introduced Dr. Dell. Did you want to go ahead and...
So with all of the things that are going on, what have you seen, in the hospitals, and how has COVID changed the way that you practice palliative medicine and hospice medicine?
So it has made a significant impact on the way that we care for our patients. I mean, and you've probably seen it on the news. And if you've ever been to the hospital today, it's just kind of amazing how this pandemic has affected us. First of all, we just don't routinely go in and see patients. I mean, we have to make sure that we're protected there so that we're protecting our patients. Patients who have COVID are in a unit by themselves. They have to, they're limited if they can have, at our facility, they don't allow visitors only under really special circumstances. So they're feeling really isolated. And they have very little way of really communicating if they don't have a means to use technology. I'd like to say that one of the positive things about this pandemic, if there are any, is that the technology is here. Back when they had the Spanish flu, they did not have the technology. So I can't imagine the level of isolation that they experienced then. Now we have people who have smartphones, cell phones, and if they don't have them themselves, we are utilizing technology and bringing it into the rooms. Not just for family members to have contact with their loved ones, but also for our staff people so that they don't have to have as much exposure in these rooms. Mm-hmm. And if they can, if they can communicate with their patients through technology in a meaningful way, then that's helping us to take care of patients without constantly having to be in the room as we typically would, without changing the quality of care, of course.
Yeah.
So, I mean, it's really kind of turned us upside down, but it just makes us be more innovative, more creative. And we do it. If you have ever had heartstrings, they're being pulled on now in a way that it's never been pulled before.
So like, what is the difference between palliative care and hospice? How are those different?
So that's a big question that I get often. And I like to explain palliative care in general as a specialty of medicine, first of all, that is devoted to the care of patients who are dealing with serious and potentially life-threatening illnesses. And the goal of palliative care generally is to relieve suffering and to improve quality of life while the patient is in the treatment phase of their illness. So you do not have to be dying. You do not have to have a prognosis of 6 months or less. You just need to have an illness that puts you in a category where you have special needs. And so I think that's the biggest difference from hospice, in that whereas patients who are receiving palliative care services are still actively engaged in the treatment phase of their illness, people who are in hospice have already made a formal decision to focus more of their care towards comfort, end of life, and making comfort their primary goal of care. So the goals are very different when you are explaining the difference between the two. So if anyone gets a recommendation from their physician that they are in need of a palliative care consultation, it is not a death sentence. Actually, it's something that I consider to be really good, because our goal is really to help them navigate through the various aspects of their serious illness in a way that respects their spiritual beliefs, their personal beliefs, and their mentation as well, their psychological support that they need as well.
Well, that's really interesting when you talk about the difference between palliative care and hospice care and the changes that have been made due to the COVID-19 pandemic. And I will say this, on the animal side, I've read quite a few articles, some in the New York Times, about pets either being there with their loved ones at home when they get sick, or when they go to the hospital. In some organizations, instead of people coming to visit, the pets may either come and visit with patients, or they may virtually kind of phone in as therapy dogs. I know one hospital here in the area in Texas where I live, it's a children's hospital, and they have continued to have a group of like Labrador retrievers and other dogs that come in and still visit with the kids. Actually, they just did a cute little montage of mask wearing 101, where they had the dogs that had masks. Some were on their face, some were on their nose, some on the top of the head, just kind of in a lighthearted way, kind of reminding people of how to wear masks, but that they're still doing that program. So I wanted to pivot over to Dr. Houston and ask her if she could explain to us about therapy animals and the difference between assistance animals and therapy animals, and how she's seen that work in the hospital setting. Dr. Rhesa, could you explain that? And welcome to the show.
Thank you. Thank you for having me. So essentially, assistance animal is an umbrella term, which is inclusive of service animals, emotional support animals, as well as therapy animals. Since you were just talking about the research or the articles that you read regarding pet therapy in the hospitals with the children, pet therapy is essentially where you have a companion animal and a person. Usually that companion animal belongs to that person, and they're going into different settings, whether that's a hospital, an assisted living facility, and they're bringing comfort to those individuals, those patients, in some way, shape, or form. And so in regards to the comfort that just being around an animal, I think you've said it before, like there are certain physiologic changes that happen in our body when we just stroke or pet an animal. Those individuals that get that engagement with that pet therapy team receive some of those benefits, just from being around an animal, and it helps with their health and well-being in some way, shape, or form, right? So pet therapy teams can go into schools, do reading education. There's research that shows that children are reading better. Reading and comprehension scores are improving when they're reading to animals because there's no judgment there, right? So if we circle back around to some of the other types of use for animals, service animals. A service animal is essentially for a person with a disability. A service animal can be is only a dog or a miniature horse, right? And people always have that reaction. You know, it's
do people really bring miniature horses with them as service animals?
A horse.
I have seen some articles, but I have never, had a patient that's a miniature horse as a service animal.
That's really cool, though.
It is.
That's different.
It is different. But if you think about the use of a service animal is for a person with a disability. Disabilities can be so broad. So you have CNI dogs or guide dogs, right? Yeah. That's the most common.
Right.
You have mobility support service animals. So with mobility support, that's generally when you have your support miniature horse. Because if this is a person that, may be larger size or in a wheelchair and they need help being pulled or tugged, then, you either have to have a large dog or a miniature horse. Valid
point.
What about the people who have I have some patients who have PTSD and they have emotional support animals. Is that something
that's a great question. That's a great question. It's a gray line, actually. So it really depends on what the diagnosis is from the healthcare provider, right? Okay. So for some individuals who have been diagnosed with PTSD, they can have a prescribed service animal that does some type of task related to decreasing whatever clinical signs are associated with their PTSD. Like, for example, there's some dogs for military vets that have issues with going into crowded spaces. Mm-hmm. The animal may go in and look in the facility and come out and tell their handler, hey, it's okay to go in, right? So that's one task. It has to be a task related to their PTSD diagnosis that the animal has to do for them, versus an emotional support animal that has been prescribed for a person with PTSD. That emotional support animal doesn't have to be trained for any particular task. That's the difference.
Are those the ones that generally go on the airplanes with people? And we've seen a lot of issues with that about people bringing their pets and they might bite somebody and, yeah. Like, is that different? Like, because they don't have to go through any type of training, but they say that they're support animals?
That's true. So emotional support animals don't have to have the same type of intense training as service animals. Okay. And on top of that, emotional support animals truly can be any species: bird, cat, rabbit, guinea pig, snake, whatever that person is attached to, whoever, they have that bond with, and they're under the care.
I'm laughing at Kiel because I know she's thinking like, why are you going to bring a parakeet on the plane and be like, that's my support.
So because of the difference in trainings between emotional support animals and service animals, that's kind of how all of these issues, in my opinion, developed in the airlines, and why the airlines had to essentially start creating their own rules and regulations. They had to self-regulate because of the liability risk that they were under, not only as a company, but the liability risk that they were having for their other clients that were without support animals traveling. Mm-hmm. Because there's really no aligned way or whatnot to determine if emotional support animal has a type of training to be able to get on a plane and not cause any problems. And it's the same thing, honestly, with service dogs. There's no regulated arena right now with different service dog training.
But most of those dogs do go through, like, especially CNI dogs go through rigorous training to do that's their job. They're working like the patients that I've seen that have those dogs. And I wanted to say PTSD stands for post-traumatic stress disorder. We're using that term, and I wanted to make sure that our audience knew what that meant. That's post-traumatic stress disorder. People who have that who are veterans, some people have that who have witnessed really heinous crimes or have been through really traumatic events in their life, and they have this disorder. But I've seen some like CNI dogs go through a lot of training, right?
Yes, they do. So CNI dogs really were honestly the first form of service animals. And so that program has really developed really well. And because the dog is their eye, for the visually impaired, yes, they have to go through rigorous training. What has happened over the course of a few years is that as people have started leaning on animals to support our health and wellness, we are navigating to using animals for other disabilities. And so, like I told you, some, CNI, hearing impaired, there's sensory signal or social signal support. So people with on the spectrum with autism, that's starting to get really popular with service animals. Medical alert, so people with whether seizures or blood sugar issues, diabetics, the reality of it is, as you have all of these other groups of support animals, the training is really vast. And it's getting, because there's no regulation, in my opinion, you have some trainers that are really promising that they can train an animal for a task or train it, period, and they can't train to the specificity of what the CNI dogs have been trained for over time, so that's my thought on it. And you have to be really, really careful with who you're paying $20,000, $30,000 for to say, hey, or more, say, hey, this dog is task trained for this disability. In my opinion, I've seen cases where people have lost that money and have been unable to use their dog for that service support.
Can you believe that? So we're talking about, again, anxiety, loneliness, death. And can you imagine somebody having to pay all of that money to have a pet by their side? And I want to segue a little bit. Thank you for that explanation, because I know a little bit about it, but I didn't know those things, like specific examples that you were giving about that. And I want to come back to how we can work more with the human medical community in managing diseases. But let's go back to Dr. Dell and talk about the changes that she's seen with, having to work in palliative care and with the COVID-19 pandemic. Can you go into a little bit more about that? And I know we want to also talk about advanced planning and why that's important as well. So if you could go into that'd be great.
Just piggybacking off of what Dr. Rhesa said, we actually, prior to COVID-19, were utilizing therapy dogs in our hospital. For a lot of our sick patients, they had regular visitations. And so with COVID-19 and the basically restricting of the majority of patients, unfortunately, we don't have that anymore. So that's another a loss that we've had with COVID-19. And, I don't know, maybe sometime soon we'll be able to bring back our service dog who was so loved in our hospital, but we'll see. But I can definitely comment that the service animal in our hospital, we only had one that I know of, because we have the hospital I work in is more of a community side, community hospital. We had a very close relationship. Everybody loved that dog, and we utilize them on a regular basis. We put in special requests. And it wasn't just for the patients, it was for our
I was just about to ask you that. Did the staff enjoy it? Okay.
Absolutely. So we're all
Dr. Dell, I just want to make one clarifying comment. It's
Yes, ma'am.
most likely an assistance animal, because service
Okay.
animals
Is that
are.
another category?
That's the umbrella category. So
Okay.
it's inclusive. So it's either in your situation, I think off of what you've expressed, the animal has been used for, it's either a pet therapy team, or you could say an assistance animal.
Okay. Thank you for that.
We're learning. We're all learning.
We're
That's
all
what this is
learning.
about.
This is how you hear between the humans and the animals that we're having.
See? But
that's why we're having this.
So you're saying because is it more so because of the risks from the trainer, the handler, the being there with the dog? Is that why?
I think it's both. It's okay. Because COVID-19 can be, they've had documented cases where animals have been known to at least be carriers of COVID-19. So there's that aspect. And then the handler also has to be very careful. And since we're limiting the amount of traffic in and out, we have to think about the safety of the handler. So for that reason, we don't even have access to that right now, but I hope we will perhaps in the near future. But with regards to COVID-19 and what we're seeing, particularly the cases who are sick enough that end up in the hospital, it's really disheartening. The predominant symptoms that we're seeing are shortness of breath. There's lots of coughing that goes on. The appetite of patients are down. They're not eating and drinking. And particularly with the patients who are elderly or from group living situations where they've had outbreaks, we see a lot of them. And some of them have pre-existing conditions such as diabetes, high blood pressure. They may have had dementia. And so that further complicates the communication between the patients and their families and their caregivers and the staff that's taking care of them. So that just adds another level of complexity to a patient who's already complex before COVID-19. So that is a large issue, and kind of brings me to the issue of having advanced care planning, because if patients are too sick, a lot of times they cannot speak for themselves. And so they're depending on a close relative, a close friend, or someone else to help be an advocate for them when they're in the hospital, particularly because there may not be a whole lot of communication that happens, either because of their illness or because of the acuity of their situation, various different factors. So my first point is that as a patient, as you are well and you're facing, the uncertainty of these times, these are the times to start having conversations about what your care preferences are. Right. And I think it's important to start contacting and reaching out to your close loved ones and start having these types of conversations, so that if you do get up in a situation where you're not able to speak for yourself and communicate what your care wishes are, you have at least designated someone who you trust, who knows what your specific values and goals are, and can be an advocate for you, or a surrogate decision maker in the setting of a critical illness. And so I think that's first and foremost. So you can do that informally, but you can also, and I would recommend doing it formally. And I recommend that because as you know, we have families and we have different dynamics. And if you have not set your family straight before this happens, it can create a lot of discord in a situation, when you're sick and there's lots going on. There's a lot of emotions going on, and people illness just brings out the worst in people, but also the best, but then also the worst. And so if you can ahead of time designate someone who you trust to be an advocate for you, that's recommendation I would have, number one. Number two is consider having more advanced care planning in the form of a living will. Okay. And for those who are not familiar with this, it is not a last will and testament. It is a document that goes into effect while you're still living, which is different from a last will and testament, which only goes into effect after you pass away. Is that correct, Attorney Priscilla?
Wow. Yes. And
I'm calling you out.
again, this is not legal advice.
Okay.
But yes, Dr. Dale, you probably have to deal with that quite a bit, being in the specialty field of palliative care. People with power of attorney, what is it called, where you have the right to make decisions about whether someone
Durable power of attorney.
the durable power of attorney, whether they if they're on life support, whether they want to be resuscitated or not. Just a lot. There are a lot of decisions. Everything that you're saying is right on point. And unfortunately, I mean, we're all Black, we're all African Americans, identify as African Americans, and we know it's harder to have these discussions, especially in our communities. A lot of people don't like to talk about death. They don't like to talk about what's going to happen to them, what's going to happen to their estate. And remember, an estate doesn't have to be a multi-million-dollar estate. It's whatever your belongings are, that's your estate. Okay. It also includes pets. Dr. Rhesa and I probably have many stories, like we were talking about before the show, about someone coming in and their parent just passed or their sibling just died and nobody thought about the dog or the cat. And what would happen to Aunt Thelma's, beloved cat Fluffy. So there are a lot of different things, and these conversations are difficult, but they need to be had. And like you said, with COVID, Dr. Dale, people are coming in and they can't breathe, like they can't even talk at these stages. And so to get that, to drive that point home, to have that advocate, the advocate to speak, that living will. And so we just really appreciate you bringing this to the forefront, because it's hard. Nobody likes to talk about it, but it's real. And Dr. Kim and I have experienced that in our family as well. So
yeah.
I would like to add on with that. When you talk about a person who is under the care of a doctor with a disability that has a service animal or even an emotional support animal, like from the get-go, when it is determined that patient will improve from the support of an animal, then at that time, you already need to start planning for if or when that patient becomes incapacitated, what's going to happen, who's going to take over care for that support animal. Service animals have a lot more abilities to go where their handler goes. They can go into the hospital setting in some situations. Emotional support animals don't. So it's important, as you're having these discussions about health and long-term, goals or whatnot, if you have a support animal, it needs to be included in that, not just a personal pet, but also the support animals specifically.
Mm-hmm.
Yeah.
Mm-hmm. Good point. So Dr. Dale, did you have an additional, because you talked about advocacy, you talked about living wills, are there any additional things that you would like our viewers to be thinking about and take action on?
Yes. First of all, I want to clarify, durable powers of attorney is great, but make sure it's for healthcare when it comes to healthcare decisions.
Right.
The living will is great as well. One of the things that I'd like to recommend is a form called the 5 Wishes form. It is nice because it's in plain English. Keep in mind, you do not need a lawyer to complete one. You can, these days, depending on where you are in the country, in our state, they've developed legislation in response to COVID-19 where you no longer require 2 witnesses, because we weren't able to find 2 witnesses in the hospital setting. Wow. So basically, they're official if you get them notarized and put in place. And lastly, my recommendation is to continue to reach out, not just to have these conversations, but to reach out in general. This is a time where everybody is stressed out. You need to take an inventory of the people who are special to you, who mean something to you, and reach out to them, not just to check on them, but for them to kind of hear from you. I mean, I think that's part of good quality living and part of taking care of each other. And I think that helps us on the clinician side in taking care of our patients. We see that the ones who have established that village are
Yeah.
the ones who tend to do better because they have that support, particularly in cancer care. I mean, it's just really difficult if you don't have that village. So while you're well, if you are a loner, if you are feeling withdrawn, I would encourage people to start reaching out, even if it's to old friends. Utilize your technology and Facebook, and but don't forget the old school. Pick up the phone. And pick up the phone. It's still there. It still exists. And there you go. And also, I like going real old school. Get a card. Write a note. Communicate and establish some communication, perhaps not even with someone, maybe a neighbor or things of that nature. We have patients who come to the hospital, they don't have anybody and they live in large communities. And it's just so sad to see.
It's different. So it's different from when we were growing up and you really knew your neighbors. And I've met a couple of my neighbors and we may wave, but more so now than ever because of social distancing. But I have older neighbors next door. I could do something like have my kids make a sign that says, hello, how are you? And put it out the window, or hope you're well. Like, I mean, just, thinking about people a little bit more in this society is something that we need to do. So I agree. I wholeheartedly agree with your recommendation to reach out. And that's actually a good segue to talk about loneliness in communities and what we've been seeing, how people have turned to social media and online platforms, and also the rates of pet adoptions have gone up. Yeah. because some people just really don't have anybody, or they're more introverted. So Dr. Rhesa, have you noticed anything in particular about the increase in pet adoptions due to loneliness? And do you have any advice for first-time pet parents who may be like, well, should I get a pet during COVID? And I mean, is this an impulse thing? Do you think it would be helpful? Can you speak on that a little bit?
Yeah, absolutely. Of course, as a general practitioner and veterinarian, we've seen an increase. Like, we were reading it in different articles about shelters, adopting out all of their animals for the first time ever. So it is a real deal. The Human Animal Bond Research Institute, I think, had a conference last year, specifically discussing the public health impact of social isolation and loneliness, right? And at that point in time, they were saying it was at epidemic levels. This was last year, pre-COVID, right? And calling it a serious public health threat. And now with the increase of social isolation because of COVID and post-COVID, we definitely have the potential to have individuals that are really, really suffering. And we know through different research with animals and animal-assisted interventions and therapy, we know that animals help to relieve signs and symptoms of social isolation and loneliness. It's a reality. It happens. So I totally get how people will want to adopt pets and things of that nature. My perspective, I always have to be an advocate for the animal, right? And there may be some people that are just kind of going out and making a quick, rash decision, not thinking of the long-term implications of adopting a whole live being, okay?
You don't think about it like that. It's a whole live being, you're right.
A whole live being that is completely dependent on you to provide it for all of its needs. Cats are a little bit more independent than dogs, right? If we're just, cats are probably the most independent, compared to gerbils and guinea pigs and all that other stuff.
They're like, I see you when I see you. Yeah. And that's when I see you. But
the reality of it is if you decide to adopt an animal or, take on the responsibility of pet ownership, you also have to think about the responsibility of doing your part to ensure the health and wellness of that animal that you just decided to take in. Average veterinary care, I looked up this what the average veterinary care was before this our talk, and I want to say it was something like $400 annually. Listen, I don't agree with that. That's too low.
I think that's too low.
Way too low.
I don't think that's right.
Way too low.
See that study. I like to see that study.
Yeah, way too low. Like, and then you have to that's just talking about, you know.
Is that like if your dog is between 5 and 7 and pretty healthy and you can take it? Yeah. Just your preventatives and you don't have to do a lot of shots. That may be what that is.
I think that is what that is. But even then, I think it's a stretch from my perspective. And then you have to include if you doing grooming or boarding or unexpected illness and food. And then this, you know, that price point shoots up. And so responsible pet ownership, yes, it's great. Yes, I want all these animals to be adopted, but I also want them to be taken care of, you know, pre and post COVID, right? Because there might be a point where they circle back around and say, this is too much. And then what happens? Then what happens to those animals?
One of my girlfriends who is single and she was in isolation. She lives out on the West Coast and she got a dog, and she and I were talking and she said, how are you taking care of these kids and working and doing this and doing that? She said, this dog. And I said, really? And she said, my God. She said, I have to feed the dog and walk the dog and do this for the dog and that for the dog. And she said, and you know what? She said, but I'm so much happier because I have somebody that depends on me. Somebody that's happy when I come home and is there for me. And she said, I miss that connection. So I happily do all these things for my little dog. She said, man, it's a lot of work. So
kid.
It's like a
kid or a child if you've never had a child. It's a good training ground.
And the reality of it is that there has been market research that compares pet owners to non-pet owners, and non-pet owners, comparatively speaking, are far less likely to have feelings of social isolation and loneliness compared to those who don't have pets. So there's a companionship factor there that really, I don't think research has quite figured out what it is.
Yeah.
But we know if we own a pet, we know that it is something real that helps us.
Yeah, I just had a great comment. Actually, it's by a wonderful friend who's a veterinarian and a manager of several hospitals. And I actually was thinking about this, and she put it, the way she put it just makes so much sense. Something that we have to think about too. One is that, you know, when you have older patients or patients with, you know, cancer diagnosis, it's like you talked about, Dr. Dale, and they have pets before they go in, you know, to the hospital, that separation for the owners can be very serious. And they may not talk about that, but there have been numerous times where I've been out at a restaurant, well, not really so much anymore, but where I've been somewhere at a social gathering and people ask, what do you do? And I tell them I'm an attorney, but I also bring up the veterinary part, and people love to talk about their pets. They love it. Yes. Somebody put up a meme and said that, you know, there's going to be a veterinarian in the hospital with COVID on a ventilator, and the doctor's gonna walk in and be like, you're a vet, can I ask you about my dog? Like that's pretty much how it goes. Like I still get a lot of questions. So one of the things that that Dr. Norwood talked about in this comment was that one thing we're gonna have to think about is not only, like I mentioned, human beings having separation anxiety, but post-pandemic, people have been spending a lot of time with their pets indoor, walking the pet, seeing them, that the pet's on the couch, they're looking at the pet on the couch, the pet's looking at them, about separation anxiety for pets, because there's actually, you know, medication that some pets have to get on because of separation anxiety, where they go through the house and like tear everything up, eat all the owner's shoes and things like that. So Dr. Houston, that's something too that people are going to have to think about, is separation anxiety if they're going out adopting these pets when they go back to work.
Yeah, absolutely. You know, it always circles back about the mutual benefit of the human-animal bond. You know, it has to be beneficial not only to the person, but to the animal as well. And there's already articles being sent out about post-COVID separation anxiety in these pets and the signs to look out for and watch out for us as veterinary practitioners, because it is going to happen at some point in time. And we need to be able to recognize if and when it happens, how are we going to support that pet parent? And most importantly, that pet that's having a really major mental health breakdown.
Yeah, that's real. And people surrendering back to shelter. She mentioned
right
that.
Because of it.
Because of that, because they're like, you know, I tried this, I can't work it out. So there are a lot of dynamics at play that people just, they don't really think about. And again, when patients are separated from their pets, Dr. Dale, I don't know if you have patients that come in and if they're able to verbalize how they feel about, you know, not having their pets, but that's a real thing.
It is. It happens quite often. And what ends up being the halfway solution is images and coordination. And you walk in to a typical pet lover's room, you're going to have a photo on the wall or a photo on the phone. That actually is what I use a lot to kind of spark the conversation and to help establish rapport with patients and just kind of bring down the level of anxiety that they might have. Just a conversation about their pet, their beloved pet. You see that, the anxiety level goes from a 10 down to a 2. I mean, it happens so effortlessly, just a mention of it. So I use that quite a bit to just kind of bring down that level and be able to kind of just make them feel more comfortable, because everybody loves talking about their kids and people love talking about their grandkids, and then people love talking about their pets.
Pets are kids. Pets are kids. They're fur babies.
Yes, fur babies.
Yeah. And it helps break up serious conversations as well. I like to end on something, upbeat. Obviously, with what I do, we deal with a lot of seriousness, but I'm always looking for ways to help patients leave the room, on a high note, if I can at all. And pets often end up being the topic of conversation that kind of helps break the ice and just be able to leave a room in the people in a good position. So I love it when patients have pets. I have a pet myself, so I understand that level of connection that they might have with their pet.
Wonderful. You did a low-key pet therapy technique. It's a very low-key pet therapy technique in engaging with your patient.
I love it. I think that way to connect is awesome. And I actually wanted to ask you both, Dr. Kim and Dr. Dale, about the mental health of healthcare professionals, regardless of if they have a pet or not, because I could only imagine the stress and strain of the influx of patients, of trying to manage patients while you are thinking about being exposed yourself, because medicine doesn't stop due to a pandemic.
Right.
Your jobs don't stop. And while I know Dr. Rhesa is still engaging as well with clients and patients, I know the exposure, the risk of exposure for the health professionals is much higher, because, obviously staff work at veterinary hospitals, but the links between transmission between pets and people, it's not as likely. So can you please talk about the mental health of healthcare professionals and how you all deal with that, and any suggestions for health professionals out there?
Yes, one of the missions of the hospital where I work is not just, taking care of patients, but also taking care of each other. And so there definitely is an effort to help minimize stress and burnout, because it definitely is there. I mean, It's when we signed up for medicine, nobody ever anticipated that there would be such a global crisis on our hands, and that could definitely affect not only our lives, but our livelihood. So it's serious for everybody. So I think what helps is that we're all in this together. Mm-hmm. When you have an organization, whether it's a private organization or of a larger group, it helps to hear from leadership down that they got your back, that they're going to provide you with the proper protection to help you to care for your patients. and that we're also mutually looking out for each other, checking in. We have a wonderful chaplain department where they're passing out snacks and cookies and lavender cotton.
Wonderful. In addition to prayers.
Yeah, exactly. In addition to the prayer. And so people are just responding and rising up and being creative on ways we can just kind of help each other kind of get through. So for me, it's getting that time out, making sure that the time out of the hospital is quality time. And I spend a lot of that time with my pet and just kind of chilling and walking, taking the dog out for a walk. That's how I kind of come down. But it's definitely a matter about taking care of each other.
I think our hospital took the stance that we need to get our minds right because they're coming. It's coming. So we thought, okay, this is going to come. Get your mind right. And we planned. And so we had, lectures, and we talked about, okay, this is who, if it comes to this, this is where you will be. And so it gave me comfort knowing that, okay, if we hit this certain number of patients, I am tier 3 because I'm a neurologist, I'm not an internist. And if it gets to that point, and these are the type of patients that I'll be taking care of on the wards. Because all of us thought in the back of our mind, like, oh my God, am I going to be back in the ICU handling an event? I don't remember how to take care of an event. But it was very comforting to me that our hospital took that stance. Like, this is where you're going to be. And then, oh, by the way, if you don't need to be here, go home.
Exactly.
See these patients virtually. And so our virtual business I think we're up 1,000% at our hospital, seeing patients virtually. And it's of itself, they were like, okay, we don't need everybody. We don't need all the neurologists going out because y'all caught it. We just need one person here who's going to take care of the inpatients because strokes continue to happen. People continue to have seizures. And in addition to having all the side effects of COVID, which, again, is stroke. So I think that's what gave me comfort. And then, like Dr. Dell said, spending quality time at home, getting away and really walking away, and, being free from the stress and finding an outlet. And I think that's the reason why some of my colleagues have gone towards pets or spend more time with their pets, because they don't ask you any questions. They're not, how was your day? They're just happy to see you. And can you feed me and take me for a walk? They don't, but they don't say it with words. You don't have to hear a bunch of words at you. So that's, I think, is something that I've noticed that a lot of my colleagues who have dogs and cats, they talk, really, their eyes light up when they talk about their animals, because it does give them that type of comfort and it gives them that type of therapy. So
I think that's a great way to end it. I think I do. I really do. And thank you both so much for sharing your experiences. And we appreciate your service, your work that you're doing, still going in, caring for your patients. Dr. Rhesa, I appreciate the work you're doing because, as you've said, there's been an uptick in people wanting preventative care and other types of care for their pets because they're spending a lot of time with them and probably can see a lot of the illnesses a lot sooner and maybe take note of that a lot sooner and pick up on those things and take better care of their pets. Right. So this has been a really enlightening discussion, and want to thank Dr. Rhesa and Dr. Dell for coming on, for sharing with us their work, their passion. I can see that in both of you. And Dr. Kim and I always like to have our call to action, right?
Right.
Okay. So I want to go with Dr. Dell. We're going to start with you. When you talked about an advocate, an actual person, whether it's a family member, a friend, please, everyone, talk about what's going on. And if you wind up in the hospital, whether it's for a surgical procedure, a chronic condition, or COVID, have somebody that can be your advocate if you have difficulties communicating about your care and any type of care that you receive. go online and research as far as giving someone the power to make medical decisions for you and whatever type of document that works best for you. Some people may want to consult an attorney. I had to throw that out there if they need to. So, but you need to have those types of documents, your wills, you need to know how your estate will be managed. And if you have pets, how they will be taken care of as well. And just like what you said, your self-care. I have on my shirt is my self-care over everything. Now, it's not really over everything. Like my faith is first, my family is second, but my self-care is very important to me. So that's something that I have to remind myself on a daily basis, because if you don't take care of yourself, you can't take care of anyone else, your patients, your family, your dog, your cat, your kids, whomever. And Dr. Rhesa, are there any any impacts, any calls to action that you would like to share with the audience?
Yeah, my call to action would be for individuals that are looking at using animals for some type of healthcare strategy. Consult a veterinarian that focuses on that aspect of veterinary medicine. That's what we do at Assistance Animals Consulting, and that's for individuals. My other call would be healthcare providers who are considering, offering this alternative type of therapy for their patients. Collaborate with a veterinary professional that focuses on, human animal bond type treatment plans, so we can ensure the optimal functioning of this human animal bond therapy strategy, healthcare strategy.
Show us your shirt.
Show us your shirt.
Only good vibes.
Yes, only good
vibes.
Hey,
we need it.
Do you have any parting words or call to action that you want us to add on to what Dr. Priscilla already said?
Connect with your family, connect with your support system and your faith, and document and provide a copy to your hospital physician and family members in terms of advanced care planning.
Okay.
Can you share your shirt with us, please?
Oh, yes. My shirt says, know your worth. And I think that's important in any aspect, whether it be as a patient, being able to speak up for yourself, or as a clinician, wherever you are in your walk of life, always value your opinion and how meaningful your life is.
Beautiful.
One last thing, I think it was question I asked you at the very beginning, the difference between palliative care and hospice. And I know for me as a neurologist, I deal with a lot of chronic diseases that will be with the patient for years and years and years, and probably would ultimately be their demise. But I think we underutilize that service. And, if you are a patient who is dealing with a chronic disease, you need to talk to your physician about getting a palliative care consult. And if you're out there in a healthcare provider and you have patients who you think might benefit from that, don't hesitate to get palliative care involved, because it can only benefit their quality of life and give them tools to continue to live a good, have good communication and have good quality to their years that they still have left. So I think that's something that we need to really focus on too. And my shirt is the Lion of Judah. So it reminds me of where my husband and I got married. We got married in Jamaica. And I think about the Lion of Judah. I think about Bob Marley and a place where I wish I could be.
Tell me about it. I would sing the words, but I don't want to get sued.
So let's all think about Jamaica right now.
Jamaica, yes, Lord. Yes, we need it. So I hope I'll be able to travel soon.
Oh, God willing. But anyway, so I want to thank you guys so much for coming. This is really a blessing. I hope that, all the people who are listening right now and those who listen in the future. So quickly, MD plus DVM, follow us on Twitter, follow us on Instagram and Facebook. Hopefully we will be doing some Facebook Lives soon, and also be able to have more of a website presence. So if you have that opportunity, subscribe to our channel, and also hit the link that will allow you to get feeds and get remarks as well as reminders when we are going to be having more shows. So we'll see you guys in 2 weeks. We're really excited. We're on episode 4. So who knew? We're just excited. So thank you guys again, and we really appreciate you too. And stay on, okay?
Yes, please
Thanks for
stay on.
having us, and
Thank
congratulations.
you.
Thank you guys so much. This was
Thanks
amazing.
for having us.
Okay, we're done.
Okay.